This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh and I'm standing in a completely dark room. I can't see a thing. Now you're seeing me on a black and white monitor. It's part of the brand new Aurora Sleep Medicine Center, and this is a brand new facility. So we're going to be sitting down with Jessica Prill today to talk about this brand new facility. So my eyes are adjusting to the light once again after being in that dark room. I'm with Jessica. We're in the control room here of the Sleep Lab. And Jessica, before we get too far into this, what is your registry?
I'm a registered polysomnographic technologist.
That is a fancy word.
It is.
But you're helping people with the problems that they have with their sleep.
Right, yep. So we're looking for sleep apnea, REM behavior disorder, narcolepsy, things like that people are suffering from and they're not sure.
Okay, and Aurora has had a sleep lab in the past, but the old one was off-site, wasn't it?
It was. We started here as a 2-lab sleep lab, and then we moved to Doctor's Court as we expanded to a 4-bed.
Okay, and now the Doctor's Court facility, there's no longer a sleep lab there. Everything here is in-house at Aurora and Oshkosh.
Yes.
All right, so tell us a little bit about the need and some of the updates you have now for this sleep study lab.
So at the new lab, we've taken a lot of time and consideration in just talking with our patients in the past, and some of the issues were the noise and just comfort in general. So we've made our rooms nice and comfortable for patients. Nobody likes to know that they're watched while they're sleeping. So we make our rooms like they're a hotel room. One of our rooms has a lift that can lift up to 1,000 pounds. So for our bariatric patients or anybody that has issues getting in and out of bed, we're able to use that as well now too.
Yeah, and we're going to take a look at the bedrooms in just a moment here. Do people use that during the day, or is that strictly a nighttime study?
We use it at night. We do have studies during the day. We run your typical shift workers still need to sleep and they still suffer from certain sleep disorders. So we run those as well as certain tests to test for narcolepsy.
Okay, and we're in the control room right now, so tell us a little bit about some of the equipment, this is new equipment that you're using here in this sleep study lab.
It is. The control room is the heart of it all because this is where we sit and we monitor the patients as they go, and this is how we watch and determine if they are having things going on while they're sleeping. And then once we do put treatment on them, this is where we watch it and kind of tweak everything to make sure that everything's going good.
So you're watching people sleep pretty much.
We are watching you sleep.
and tell me, now there's a staff of 3 people in the sleep study lab?
We do. We have a staff of 3. It's myself and my 2 co-partners back behind me here. And then we do have a PRN on staff as well.
All right. Well, let's take a look at the bedrooms and we'll kind of describe some of the things, some of the new things they have here at Aurora. All right, Jessica, so we're in one of the bedrooms here in the sleep lab, and kind of take us through this. As I come in here and take a look, it looks like a hotel room to me, or just a normal bedroom.
Oh, that's good, because that's what we were aiming for. You're actually in our ocean view room, which has the built-in lift here, which is new to the hospital and a lot of the inpatient hospital rooms as well, so we can use this too if we needed to.
Now, you have 4 bedrooms, but that's the only one with the lift? Why do you need the lift?
Well, we have bariatric patients, but we just have patients in general that are ill and just cannot get in and out of bed as easily as some other patients, so this way this can help us.
Okay, so outside of this looking like a normal hotel room or bedroom, what are some of the other features for the sleep lab?
Well, the beds are sleep number beds, so that seems to be a favorite. For the sleep lab in general, you'll notice the little speaker above here, so that's how we can hear the patients throughout the night. We ask that they just talk to us through just the room, and then we can come in here and answer any questions that they need.
Okay, and I noticed there's what looks to be a camera?
Yep, there is the camera, and then the little black box behind it is the infrared light so that we can see, obviously, the patient in the dark.
Okay, and then it's a TV, it's a closet. The bathroom is hotel quality as well.
Yeah, it's a spacious bathroom with your own shower inside there. So
the idea is to keep the patient, the subject, as comfortable as possible so they can get a good night's sleep?
Yep, and we want to make sure that they feel that they have their privacy too. It's already something to feel that you're being intruded on while we're watching you sleep. So we wanted to make it a little bit more private. You don't have to go out of your room to use the restroom. It's right here in your room itself. So
now, obviously, this is a sleep study, so there are some wires and things that the patient then is hooked up to as well?
there are right here, you'll notice that that's our CPAP machine, and that goes with our sleep system itself, so that will help us monitor you over in the control room.
Okay, so it's really just trying to make this as comfortable as possible, trying to make it as normal for somebody to sleep so that you can get a proper reading on what's going on with the patient.
Yep, we try to do as much as we can to make you forget about the wires.
All right, well, this is an incredible facility, and I know you guys are going to be helping a lot of people with this. Thanks for taking some time with us today.
You bet, thank you.
If you're having any problems sleeping, you should check with your primary care provider first, but if you have any other questions, give us a call at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.